dear colleagues. I would be discussing upon the prevalence, risk factor, pattern, and the treatment outcome of severe ROP in Jharkhand. As we all know, ROP is a disease of retinal vascular and capillary proliferation affecting the premature infant who undergo the oxygen therapy. So, it was a retrospective observational study done at the tertiary care center in the Jharkhand. The study evaluated the incidence, risk factor, and severity of ROP in relation to the gestational age, birth weight, and the treatment modalities. Where our inclusion criteria was as per the neonatal guidelines of India: birth weight less than 2 kg, gestational age less than 34 weeks, gestational age between 34 to 36 weeks if exposed to risk factor like prolonged supplementary oxygen, respiratory distress, or blood transfusion. The ICROP3 was used to record the stage, location, zones, and signs of the plus disease. We have our follow-up first at between the 4 to 6 weeks of life, and the final follow-up was till the retinal full vascularization and the maximum stage of ROP. The data was analyzed using the SPSS software. So our results were we had a total of 646 infants. Mean gestational age was 32 weeks. Mean birth weight was 1.6 kg. Mean gestational age at the time of ROP examination was 37 weeks. We had more of C-section deliveries, and we had one more correlation, that was the 417 babies were born by the ART, that is the IVF technology. So coming on to the incidence part, 49% babies had no ROP, 21 babies had zone 2 stage 3 plus disease that needed ROP laser, and 15% baby had AP ROP that was treated with injection anti-VEGF followed by ROP laser, and 14% baby had zone 3 stage 1 no plus that were just kept on the follow-up observation. They showed spontaneous regression in due course of time. 1% baby had stage 5 ROP that needed ROP surgery. Coming on to our treatment outcome, among the stage 5 ROP, one baby showed regression with the retina on in the consecutive follow-up. Zone 2 stage 3, those needed ROP laser all show regression. EP ROP, only one needed augmented laser, and the spontaneous regression group. So coming on to the result part, the risk factor associated with ROP were lower birth weight, gestational age, and our respiratory distress syndrome. Discussion part, ROP is a serious morbidity of prematurity whose incidence and severity increases with the decreasing gestational age and birth weight. Our finding is not comparable to those from the other study. Being a tertiary care center, we had more of high-risk babies, more IVF babies. So we had a higher incidence of ROP, especially the severe ROP. As we all know that birth weight, gestational age, and respiratory distress are well-known risk factor for the ROP. In this study, a lower birth weight, shorter gestational age RDS were independent risk factors for the severe ROP in infants. So we can conclude that high incidence of infants with the ROP in our study emphasize the need for aggressive measures for prevention and control of the disease. The safe implementation of oxygen therapy with appropriate monitoring, better antenatal and neonatal care, meticulous attention to hygienic processes, and control of sepsis may reduce the prevalence of ROP. Early referral, adequate treatment, and regular follow-up necessary. These were my references. Thank you, AIOS, for this opportunity.